there you have it. The story has been solved. That's how Ash got her Hollywood smile.
Tom, don't feel left out, though. I'm sure our next guest will be able to help you achieve your own set of China white chops. Here to talk about dental hygiene is Dr. Beverley Watson. Welcome to the Studio One sofa.
Thank you.
So let's cut to the chase. Why is oral hygiene so important in our daily lives?
Well, it's interesting. A lot of people just think that it's about the appearance of your teeth, but research is showing us now that it does affect your general health. The plaque bacteria can be actually found into the heart arteries now. So flossing is something that's not just good for your oral health, it's good for your general health as well. So.
What really happens if you really, I don't know what it is, but whenever I'm talking to dentists, I just have to be, no, what really happens when, no, we obviously, we know about decay, we get educated about a lot, but what are the other sort of knock-on problems that can occur if we're not taking the right approaches, apart from the heart problems that should be mentioned?
Well, I don't know if you've heard the expression long in the tooth.
Yeah.
So a lot of people, they just presume as you get older that your teeth, are going to get longer. But by not looking after them properly, or the other side, by brushing them too much, you will eventually get to cause recession to your gums, which means your gums will eventually move away from where they're supposed to be, and then you'll end up having these very long gnashes.
Right, enough of the...
Moving on, you brought some gadgets and
Sure.
some tools with you.
Yeah.
So what are some tips you can give us to keeping our teeth healthy
Probably
and clean?
the most important tip I can give you is floss. Floss,
Really?
floss, floss.
Every day, day and night?
Once a day is fine.
Once a day is fine.
Yeah. So I'm going to do a little demonstration for you. So maybe you'd like to be involved,
Yeah,
bit of
Tom will
audience
follow along.
participation.
Sure,
So,
why not?
normally,
oral guinea pig today.
normally I will get a length about as long as my arm,
Right.
okay? Just so you have enough to play with. So Tom, you can take this. Now, instinctively, people will put it between their index fingers. Try and always put it between your two middle fingers.
You getting this, Tom? No?
Are you paying attention?
It's just a piece of dental floss, Tom.
Okay, great.
Okay.
And then you use your index fingers for the lowers, thumbs for the uppers.
Okay.
Oh,
Okay.
There's a whole art behind it.
So what you normally do, I normally just...
Don't worry, sorry.
I normally would just pull my cheek out of the way and just go right to the back with my thumbs, come all the way around, right to the back, and then start on the lowers. So
Yeah.
you're methodically working around. And
Hey.
this way...
Best to do that in private. It's not the
Yeah.
most attractive looking.
really
All right,
is
is
a
everyone
procedure.
watching? Are you ready? No, I mean, is there such a thing as too much flossing? Does that do, or doing it too hard? I mean,
You can do it too hard. That's why this technique is very good, because you do have a lot more control.
okay.
If you put it in your index fingers,
Sure.
before you know it,
All right, let's
Okay.
move on to our next one. Manual or electric?
it depends with the technique that you use. I'm going to very, very quickly just show you, okay? Manual toothbrush, always just try and treat every tooth as an individual, okay? You're trying to do little massaging technique, each individual tooth.
Okay.
And work your way around,
Right.
okay? Electric toothbrush, I really do like the more vibratoring electric toothbrush rather than the oscillating one.
Okay.
Okay.
But it's definitely down to preference. But again, it's always treating every tooth as an individual. Okay?
Okay.
The main thing to remember is do not scrub or up and down.
Okay. Okay.
And that's about it.
All right. And you have a couple more gadgets
I
here as
do.
well. The
So,
floss set.
3
and-
main things to keep your mouth healthy for life. That's brushing twice a day with a good technique,
Yeah.
flossing once a day, and brushing your tongue. I really like this one at the moment. It's a
Okay.
very good tongue cleanser. A lot of people don't like the idea of that, but a lot of the bacteria can sit on the tongue and give us bad breath.
Okay.
This is the main cause.
Some great advice, and of course it avoids us getting nasty gnashes and bits and pieces. Just one final question.
Yes.
How often do we have to come and see you?
To see a hygienist, I would recommend between 3 months and 6 months.
Really?
Yes.
It's long overdue. I'll come and see you very soon.
That would be great.
Thank you very much indeed for being with us on the sofa.
You're very welcome.
It's been an absolute pleasure. Thanks for your great advice.
Thank you.
Now, Dr. Beverley Watson has very kindly offered to give not one, not two, but 3 lucky winners on tonight's show dental hygiene goodie bags with a voucher worth 200 dirhams for Dr. Michael's Dental Clinic.
And all you have to do is go on to our Facebook page right now and write, "I want pearly whites."